This is the Prostate Pit Stop. One man's journey, everyone's fight. With Keith Smith and Matt McChlery. Sponsored by the Ferry Project. Visit our website, ferryproject.org.uk. Hello and welcome to the third episode of Prostate Pit Stop. I'm Matt.
Hi, and I'm Keith.
And we're back again talking all things prostate cancer and, of course, accompanying Keith on his journey. So last episode, whenever that was that you listened to it, who knows, you might be listening to them back to back. So anyway, last time we were speaking about your diagnosis.
Yes.
And you then were having a scan. So what was the result of the scan and sort of what decisions have been made from that point?
Yeah, okay. Well, let's just quickly go back. So remember, as asymptomatic, this was something that had been picked up because I'd been ill in the past and they were keeping an eye on my prostate because I'd had prostate infections. So my PSA test had gone up from just 5 to 5.2. And because it had gone up, that was the key thing. It wasn't the level, it was the fact that it had gone up. And then I got a second reading where it had gone up again. And so they said, let's have an MRI scan. We did an MRI scan where the MRI scan showed that I had what they called a lesion. And then they did a biopsy. So the biopsy, the results for the biopsy took 4 weeks. And if I'm being honest, because it took 4 weeks to get a response back, I was starting to relax a bit. And the relaxation was around the fact that I thought, there might well be something wrong. But we all know with prostate cancer, there's different types of it. And so there's some that's quick. Some that's relatively straightforward in the sense that you keep an eye on it. It isn't causing any problems. That's right. Exactly. So, and in my head, I'd decided, because I hadn't got a response for 4 weeks, that if I had anything, it was like that. And then I received a phone call, and the phone call basically said, Mr. Smith, can you come in for an appointment tomorrow, please? We'll give you the test results and talk about your care afterwards. And I thought, okay, care. Okay, that's an interesting one. So, as you know, Matt, I'm a Christian. On the morning of that, I actually I do a Bible reading, and one of my Bible readings on that was James 1, which basically said, "Consider it pure joy when you face trials of many different kinds." And I just saw that as a little warning flag, not something terrible's about to happen, but prepare yourself. So when we went in, and actually the doctor started saying, right, we just need to tell you that we found cancer. And then he started to go through the cancer. So basically I had some of the highest levels, most aggressive type of cancer. And I had some medium levels. And the high level cancer, there was he said only a small bit at this moment in time, but the medium level cancer. So suddenly we went from me thinking, I might have a bit of cancer, but it doesn't matter, to him starting to talk about this was serious and stuff needed to happen relatively quickly. So he gave us two options. And the guy I was talking to, the doctor I was talking to, was trying to be as clear as possible and as open as possible. But he said that because of the nature of the cancer, he'd have to, we got these two choices. So one was radiotherapy and one was an operation. The radiotherapy was interesting in the sense that he said most people choose radiotherapy, but he, as I've mentioned in the last podcast, he said I was a bit young, that in my case, there is a chance that with the radiotherapy that the cancer could return over time. And in that case, after radiotherapy, the next treatments are less successful.
It kind of shreds it up or something, and they can't quite.
Yeah. So the radiotherapy actually, it impacts the organs, and effectively it makes it difficult to remove the prostate by itself. He described it as, I'm not medical, but he described it, the organs as almost fusing together. And since the prostate is near the bowel, you've now got all sorts of complications about if you're going to operate on it.
This is after radiotherapy.
Yeah, after the radiotherapy.
Yeah.
So he said he didn't tell me what to do. He was very careful not to tell me what to do, but he explained that there was a chance of it coming back, and if it came back, the options after radiotherapy were more limited and less successful.
But if you had the operation instead at this point, what would then be, if it came back, what would be the option?
Yeah, well, the key with the operation is, as he put it, if you haven't got a prostate and we've taken out all the prostate and the cancer's still on the prostate and just in the prostate, you can't have prostate cancer because you haven't got a prostate to have prostate cancer with. So if they get all the cancer out, then the cancer is dealt with. However, if some of the cancer has already spread from the prostate into other bits of the body, they'd identify that and they could do radiotherapy then.
And that would be more successful because...
Yeah, well, and not only that, but it's a backup plan. So in a sense, you've got 99% of it and now 1% escaped and you kill it with radiotherapy. If you do it the other way around, if you have radiotherapy and then opt for an operation to get rid of the prostate, you've got it's more complex and much more challenging. So he said, effectively, I get 2 bites of the cherry this way around. Now, the reason, and we're trying to be open in this podcast, the reason that most people don't go for the operation straight away is the operation has a massive impact on your sex life. And also it can lead to incontinence and other things. With the radiotherapy, the impacts are small and there's still some difficulties, but it's not at the same level. So one is dramatic. If you haven't got a prostate, then the prostate actually helps you have an erection. So if you haven't got that, then there's all those complications. So it is a big decision because the operation is life-changing. Your life will not be the same afterwards, or it's not very likely to be the same. If with real skill, I've read up as much as I can about it, with real skill, and if everything's on your side, where the cancer is and everything else, then it isn't that's the end of your sex life and so on. But it does change. Things will be different.
Yeah.
So that's the key question. So we had to make the decision. But before that, where you were pointing at is they needed to test to see if the cancer had spread already.
Yeah, because that would impact, wouldn't it? Because if it's contained within the prostate, the 2 options we've just discussed are the viable ones. But if it's already spread elsewhere, then surely they would have other treatment plans to follow in that scenario.
Yeah. So it's into full oncology then. So then you
chemotherapy and all of that.
Yeah, chemotherapy, other radiotherapies, depending on where the cancer is, there'd be all sorts of therapies associated with
and as
that.
we said in the first podcast, each cancer is so different. And not just that, I mean, when I was being treated for my non-Hodgkin lymphoma cancer, even within that, yes, it's the same cancer, but the sort of the cocktail that they create cocktails. It's almost like you're going to a bar, and you've got all these this menu of all these different mixes of all these different drinks, and they all taste different and all that kind of stuff. It's quite similar in the cancer treatment world where, my particular cocktail is quite different to somebody else's. And even within that, I mean, after the first or 2, because I had chemotherapy, the first or second chemotherapy cycle that you go through, you have a meeting with the doctor who says, okay, so how was that for you? What about this? And what about that? And what about nausea and all this? And you say, okay, well, I'm going to increase this and I'm going to take this out and I'm going to tweak this a bit. And so even within your treatment, your cocktails constantly being adjusted and adapted for your specific needs. So yeah, it is quite tailor-made, which I found very interesting.
And the other bit about it, obviously, is if it's actually spread, then now, let's face it, your prognosis is much more challenging because they have to deal now with multiple cancer sites and so on. So actually finding out if it's spread, both in the treatment but also in the severity of the cancer, is key. So they actually booked me in for appointments I got them within 10 days. Of the initial consultation. And that was a CT scan and a bone scan to actually see where it was. And I'm pleased to say they gave me the results of that within 10 days again. I'm pleased to say that I was clear. So effectively...
So it's just containing the prostate in your case?
Yes.
Okay.
So effectively, just before Christmas, I found out that the radiotherapy or surgery was the two options I could take. And when they told me the results, they asked me there and then to make a decision about whether I was going to go for radiotherapy or surgery. I'd spoken with my wife, and it's obviously not just a lone decision. And I've got relatives who are in the medical profession, so I'd spoken with them. And so I chose the surgery. It seemed to give a better for me, a better chance of a longer lifespan, and so on. So I didn't take that lightly, but yeah.
And what did the doctor say about sort of, because all of that was happening sort of 10 days, this happened, another 10 days, that happened. Where are we at in terms of the operation that you opted for?
What now?
Now, yeah.
So that now is over, just over 2 weeks, waiting for the operation. That's fine. They said that they would expect the operation to be taking place within 4 weeks based on where we are, because I actually met with the surgeon straight after Christmas, and he talked through the surgery in detail. Really nice man. But yes, he said the normal wait at the moment at that time was 4 weeks, and they would contact me. So I'm waiting for that contact.
Waiting for that phone call. Oh, and how are you finding that?
Yeah, out of everything, if I'm being honest, I'm finding this wait some of the most challenging. I was saying to my wife, I've never had an event before in my life which, in a sense, I want to happen, and at the same time I'm dreading. So you have very mixed emotions.
Yes, you want it to happen, but you also really don't want it to happen. But then you really do want it to happen, because you know if it doesn't happen, the consequences are pretty final, and that could be the end, so yeah.
So
Caught between a rock and a hard place sometimes, isn't it?
Well, I was saying to my wife, it was interesting because yesterday was my wife's birthday, and we went out and we spent the day together, and we had lunch together, and we were just talking about it. And I said that to her. I said I've never been in this position before, and I said, but actually, no, she said, but actually she had, because it was a bit like pregnancy and labour. We've got 5 children, and she said that never once did she look forward to the labour. It was not something she looked forward to, but she was looking forward to the outcome, which was the baby. And she said, so she'd had whole, chunks of time where she was waiting, not knowing when the baby was going to be born, knowing that the things would change dramatically, not looking forward to the experience at all. And she had a couple of very difficult labours, one an emergency cesarean and stuff like this. But still wanting the baby, the outcome. So she said she could sympathise with where I was at the moment. But yeah, it's not something that in day-to-day life, on the whole, most of us don't experience this type of situation. So yeah, emotionally, I do find that I found that challenging, and certainly for me, I had to spend a lot of time praying about that, asking for the Holy Spirit to fill me, to give me a chance to actually have the strength to go on during a normal day without being distracted all the time by thoughts about what
and
about
the
this
thoughts
and that.
really do creep up on you, don't they?
Yeah.
Especially, even when you're in it. I mean, you wake up in the morning and you think, oh, everything's fine, and then 2 seconds later you go, oh yeah, oh yeah, it's not normal, is it? And and it does creep up on you sometimes.
It does. It reminds me about grief, because my own parents obviously died, and my wife's parents died, and I've had other friends who have died and family members. And grief just appears. You can be walking through your day, everything could be perfectly normal, and then suddenly it smacks you across the face. And I'm finding very similar things. I could be doing something absolutely normally, and everything's fine, and then suddenly these emotions come up. So this is, for me, out of the whole experience so far, this is the most challenging time, simply because emotionally, I keep getting caught out, and I'm trying to finish up my work because I'm going to retire in my work. When the operation happens, I won't have much time afterwards. So I'm trying to tidy all that up and be very professional while I'm doing that, whilst at the same time be doing something, and suddenly I'll get a slap across the face and feel very emotional and need to just go away and pull myself together, if you like. It's all very interesting.
Well, so we are stuck in this waiting time. I don't know. We plan to have these podcasts fairly regularly. So, the next time we speak, you might have had your operation, you might not. And as listeners, join us on this journey.
Yep, exactly.
We stuck in this time of waiting, and we might be waiting together for a while. So, we'll be back soon with another episode of Prostate Pit Stop, where we continue to find out more about where Keith's at on his journey with prostate cancer. But thank you for listening. Don't forget, please, to subscribe and also share this podcast with your family, with your friends, because it will hopefully open up really important conversations.
Absolutely.
So, yeah, thank you for listening, and we'll look forward to seeing you soon. Goodbye.
Bye-bye.
Thanks for listening to the Prostate Pit Stop, sponsored by the Ferry Project. Make sure you subscribe and share.